I'm John Miglosh for the Wisconsin DMA and the International Society for Strategic Marketing. Coming to you live from Heartland, Wisconsin. How about that? Okay, so let's get over to our kickoff article, which of course is the Tom Fishburne cartoon for uh, this week. Urgency without clarity on digital transformation. Since it's our top priority since it's our top priority, and Tom later in the article said the only thing for sure about digital transformation is that 94% of CEOs said we need to do digital transformation. Since it's our top priority, what do we mean by digital transformation? How about Zoom meetings, using Slack, digital first, data driven, customer centric, don't forget agile and something with the cloud, making TikTok videos, and maybe we should start with what it doesn't mean because, it's been co-opted by everything. Now, as an old guy in marketing, I've watched this process happen with direct marketing, where it used to mean, well, first it was direct mail marketing, where we rented lists and tested things, and it was very clear what we were doing. But they wanted to make the tent bigger, so then they defined it as direct marketing. And the direct marketing definition became totally worthless because it talked about measurable data rather than measurement and testing. They left the testing out. It got all watered down. So then it turned to database marketing, database. And I watched that happen because I was building some of the biggest databases, certainly in marketing, but in the world. And so I was speaking at all the conferences. And then the database went to data-driven marketing. And then we got big data, and then we got AI, and now we're into digital transformation. And really, has any of it meant anything? Really, not sure. But Tom says organizations are feeling the sudden increased urgency of digital transformation, but nobody knows what it means. Colgate-Palmolive recently touted their TikTok-led digital transformation. TikTok. It says that there's going to be about $1 trillion spent, and that was maybe pre-coronavirus, $1 trillion on digital transformation, but 70% of those transformations fail. 94% reported of senior leaders reported that digital transformation was high on their priorities. We had a great article yesterday from, I think it was The Hustle, that talked about how a guy who was selling bread pivoted and started selling bread kits directly to consumers because he had plenty of yeast and everybody was looking for yeast. And now there's a fast, and he had never really shipped, direct to consumer. Now there was a digital transformation in a heartbeat. Like I said, it doesn't even take a computer. Here's Tom's cartoon from last week. And I think he said this was his number 2 best-selling cartoon of all time. And that is probably will become the best because of its simplicity. I really like the simplicity, but it doesn't really tell you what to do about it. And this is one that was also a big hit. Glad we're all aligned. Yeah, okay. And that's a good one too. So anyway, there's a bunch of them that apply. This was an interesting article in Media Post in the protected firewalled version. So I don't exactly know what it means. It says that COVID-19 loses sway over consumer conversations as mood lifts. And this is like 1 week of data. It's 36,000 consumers. What I thought was fascinating was it plots in a sort of a smooth curve, because there were probably real numbers around this, but it shows it as a smooth curve, which is a graph option sometimes. And it's based on it's based on consumers using the term COVID-19 and putting emojis on it. Now, I didn't know that emojis were tracked like this. I maybe should use fewer emojis. And of course, my kids think it's funny because I put them together in strings that they can't understand. And sometimes I just do it randomly to see what they'll come up with, and then try to come up with a compelling explanation of why it makes sense. So we're going to skip that one. Okay, this is a really, really, really excellent article. Embracing the Unknown in Our Data-Centric World by Alex Manning. This was one of the better articles I've read lately from the Drum. We constantly strive for certainty. Various studies have shown that we loathe not knowing an outcome even more than the certainty of a negative result. This is great. There's some great psychological studies. Roy Sutherland explained that the appeal of Uber is that we can track our ride as it approaches. So in a dizzying world of unpredictability and rapid change right now, hard facts are comforting. If it goes without, and if it all goes wrong, then we can't be blamed for it because we're just doing what the data told us. And that's why it's never been more critical for us to apply data in an appropriate manner. But over-reliance on data is a problem of our own making. We've held up data as a risk remover. We shy away from trying anything that has not been proven to work in the past. We use data selectively to support our preconceived notions, like a drunk who uses a lamppost for support rather than illumination. The author says we should be looking at the data and the research and always asking why. Let's underline that. As well as trying to predict how our interpretations will land in the real world. You know, if I had a nickel for every time somebody said, well, we did a backtest model and it outperformed yours. Yeah, okay. Let's mail it and see if it outperforms mine. Because, you know, correlations are a dime a dozen, and the bigger the data, the more correlations you get. And the more correlations you get, the more spurious correlations you get. And guess what? They're not causal. They're not going to be connected to the why, and they're not going to work in the real world. So after I've taken my model and kicked out what I think is all the spurious stuff, don't be surprised that you can beat it by filling your model with silly. Yeah, you'll get even better lift. And if you're a marketer who looks at backdated models to decide which modeler to use, you should be fired. Okay, accepting that uncertainty is a fundamental ingredient of breaking new ground. Here's another issue that he doesn't really raise. Uncertainty is baked in to data. Why? Because data is always historical. People talk about real-time data, but it's always historical. It's never in the future. You can never look at future data. There is no future data. It's always historical. And because it's always historical, it will never exactly tell you what's going to happen next. Never. There's always an epistemological gap between the past and the future. Tomorrow will be like yesterday, except if it isn't. Who saw this coming? That all the governments of the world would shut down all of their economies? Nobody. It's never been done before. It's crazy. I think it's a little crazy, but whether it's crazy or not, it's never been done before. And so history repeats itself, kinda, but only in big principles. Okay, so there's always uncertainty in data. There's never enough data to make a decision because the decision is future and data is past, and that's the way it is. Okay, so if we're feeling entirely comfortable, we haven't pushed the thought far enough. Okay, and that's also why if you're deciding on models and you're deciding on AI and all this, you need to be thinking about people that have been through the stormy seas of uncertainty and not just grabbing some AI thing that's based on algorithms that are 2 months old or 3. Okay? Embracing the unknown is not for the faint-hearted brand. And see, I disagree fundamentally, Alex, because the unknown is going to hit you like a freight train. It's going to anyway. So embracing the unknown is not about whether or not the unknown is going to hit you. It's going to hit you. So it's not, you can try and embrace it, but it's going to hit you anyway. So the problem here is our epistemology, our conviction that data is everything, but data is only history, and we have to make decisions in the future. And as Lee Iacocca said, even the right decision made too late is wrong. So I wanted to talk about coronavirus, but there's a metaphor in philosophy. When we did philosophy of science, we asked ourselves, which would be better? Which would be better, an inaccurate, consistent bathroom scale, or a, or 10 precise, inconsistent bathroom scales? And the answer is it's kind of a wash, depending on how inconsistent the 10 are, okay? But this is not a stock chart from the last week or two, although it really does look like it. This is my own bathroom scale weight. And I have a scale that goes to a tenth of a pound. What the point of a tenth of a pound is, I'm not sure. I ignore them all because it's easier to key it in by the just gross poundage. But here I am back in the beginning of 2017, January 2017. We had a wedding. I had to get into a suit that I wanted to wear for the rehearsal dinner. I bought a suit for my overweight size, but I wanted to get into some other suits. So I lost a lot of weight, and the wedding was in here someplace, April. And then I steadily went up to almost the same peak. And then I got serious again and went down a little bit. And you can see up, then serious, then up, then serious. This is when I found the carnivore diet. And then we have some carb periods. I go from meat to vegan, and I always go up on the vegan. Anyway, but the point is that we can see some clear trends here, wouldn't you say? This is definitely down, and this is definitely up, right? And you could say this is really, you got really serious here, and I saw some pictures of myself and very scared. Now it looks like a real stock chart. Okay, so the point is that you'd be better off. I don't know if my scale is accurate. In fact, when I go to the doctor and I weighed 165 pounds the last time, and they said you weigh 175. Now that's with my clothes and stuff. But what it suggests is that my scale is completely off, and it could be. But guess what? We see the trends. And this is more the way that past data applies to the future. But I can tell you what, I fit into clothes a lot better down here than I did up here. I had nothing that fit. Okay, so now we're going to talk about the coronavirus because we said we would. And the coronavirus, when we were looking at Italy, and Dr. Birx said that we used Italy as the foundation for our models, and that's where they got the 2 million projection with mitigation. People forget. And then they came to a 200,000 with mitigation. And then they settled on this, let's have everybody stay home, which had some basis. St. Louis in the Spanish flu actually worked harder at social distancing back in 1918 and had a much lower death rate. So there was some precedent, there was some data. But the world has never gone to this length trying to isolate seemingly healthy people, because it's looking like, well, this was from yesterday. So the Italian death rate suggested something like 10% mortality. Now, also what we see now is that 99% or something of the Italian deaths had at least one comorbidity, and 50% had 3. So there was also some controversy in Minnesota because a doctor who was also a state legislator, I believe, got a letter saying that if in doubt, classify it as a Corona-19 or a COVID-19 mortality. All of those things impact the meaning of the data. It's okay to measure however you want to measure. But if you measured flu leading to pneumonia as pneumonia death in the past, and then you compared COVID-19 leading to pneumonia and called it a COVID-19 because maybe your hospital got more money if you classified it that way, or maybe the state got more aid, or there's any number of reasons why we count things the way we do, but oftentimes there's an incentive toward one or the other. And so if you take so this is from yesterday in LA County, and what they're saying is that if you just look at the tested, identified COVID-19 cases, there was about, I don't know, the numbers are down here, but it comes to 4.5%, which is close to the Italian rate. Okay, but now what they're doing is they're using a better testing method. They tested 863, UCLA tested them, and found that approximately 4.1% of the county's population had antibodies to the virus. I don't know the ins and outs of the science, but what that suggested was that the study said that the fatality rate, instead of being 4.5%, is more like 0.1, which would be normal flu, or 0.2. Okay? Now, this virus is sneaky. It doesn't show symptoms as much and so as regular flu, and so consequently people don't stay home with it. They go out and walk around, which may suggest that the shutdown methodology is warranted, because if you have 60% infection, what was H1N1? 60 million people, they estimated, were infected, and they do this with random samples of a population. They don't test everybody, but they find what the rate is across good sample sets of 1,000 or so in different states or different cities. That's how it's done. It's a very well documented, well tested procedure. But what they're saying is that so if you have a high transmission rate, and so 60 million in H1N1 would be about, out of 300 million, that's about 6 times 5 is 30, so that's about 20% infection rate. Okay, right now it's at about 4.5% according to their study. So there's still some ways to go, and if it's more infectious than regular flu, but just as deadly, then you'll get more deaths. And that's how the numbers kind of work out. So they're saying that the number of infected adults is 28 to 55 times higher than the tally. One of the reasons I like LA County is because, they're not a bastion of the Bible Belt or something. If anything, if there were a data skew, like say in New York City, where they needed money to prop up their hospitals, then LA County has kind of the same basic political orientation as, I would say, as New York City, very progressive. So here's where Los Angeles County reported 617 deaths out of 13,000 confirmed cases, which implies this 4.5 mortality. But this antibody test, which both Stanford and the manufacturer confirm basically very few false positives, 0.5% false positives on this test, much more accurate, suggests that lower mortality rate, but a high infection rate. But even a high infection rate probably only gets us to 20 or 30%. What happens is the virility goes down over time of these flus. That's how they pass out of existence, and and often the contagion goes down because of sunshine and summer and all kinds of stuff. So 95% are still unaffected. Shows, according to this article, shows that the statewide lockdown is working. I'm not sure where you go with this, but the point is that the data is very crucial, right? Here's about the false positives. They're very, very low in relatively high count back test. So anyway, what does that all mean? What it all means is, oops, I got way off here. What does that all mean? What it means is that how we count is crucial to what we know. And there is a great need for integrity. And we have the same issues. We have the same issues in marketing as we have in unprecedented health crisis. Went a little long, but I wanted you to think about how do you handle data? That excellent article by Alex. Data is always historical. It never tells you the complete answer till after the opportunity is gone. So I encourage you as marketers to have a very skeptical approach and think hard about how you can validate from multiple perspectives. And I would also encourage you to use an old white guy, not an old white guy, old white beard guy. That's cost cultural. An old guy who's been through it before. I'm John Miglash. Like and share. Your friends will think you're smart. Bye-bye.